Good morning. I am now calling the Speech Language Pathology and Audiology and Hearing Aid Dispensers Board meeting to order. It is May 16th, 9 a.m. I will start with roll call. I'll start with myself, Gilda Dominguez, Board Chair, present. Dr. Amy White.
Here.
Mr. Todd Borges.
Here.
Dr. Tamara Chambers.
Here.
Dr. Charles Sanders.
Here.
Ms. Karen Chang. She is absent. Myself and Dr. Chambers are present at the Galeras Family Education Center, 427 West Carroll Avenue, Room 2, Glendora, California, 91741. There are no members of the public present with us at this time. I'd like to ask those who are present at the Sacramento location to state who is present and if there are any members of the public present with them.
Sure. Amy White, also here with Dr. Charles Sanders and Todd Borges, as well as board staff. And I suppose they'll introduce themselves, but we're all at the board office on 1601 Response Road, Suite 260, second floor, Sacramento, California, 95815. There are no members of the public here.
Thank you. Board staff and council?
We have here today Sharice Burns, myself, Executive Officer, Maria Lorenzo, Legislative and Regulatory Analyst, and Tim Yang, Enforcement Analyst. And we have Legal Counsel.
Yuping Lin, Board Counsel, also present.
All right, thank you. With the board members, we do have a quorum. Moving on to agenda item 2, public comment for items not on the agenda. I'd like to ask the moderator to open public comment on WebEx.
All right, we are open for public comment via WebEx. If you'd like to make a comment, please raise your hand by tapping that hand button at the bottom of the screen. Dial-in users, dial *3 to raise your hand. And for our mobile device users, you may need to hit the ellipses button, it's the ... in order to find your hand. People will be given 3 minutes to speak, and I'll give you a 30-second warning before your time expires. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no requests for public comment, do you wish to continue with the agenda?
Yes, please. Before we move on to agenda item 3, I just want to confirm that there are still no members of the public present here at the Glendora location. Are there any members of the public present at the Sacramento location?
There are not.
Thank you. Okay, moving on to agenda item 3, review and possible approval for the February 21st, 2025 board meeting minutes. I'd like to ask Ms. Lorenzo to present this agenda item.
Thank you, Ms. Dominguez. It includes the board meeting with updates of board activities, including board legislative proposal for the omnibus bill and adopted regulations regarding advertising for hearing aid dispensing. At this meeting, the board held a petition hearing and met in closed sessions to discuss disciplinary matters and consider and take action on the appointment of an executive officer. Staff recommends the board review and discuss the provided material and determine whether or not to approve the minutes.
All right, thank you for that. I'd like to open up for board discussion. Are there any comments or discussion from the board members? Okay, hearing none, I'd like to ask for a motion to approve the February 21st, 2025 board meeting minutes.
This is Dr. White. Move to approve.
Okay, thank you. May I have a second?
Second.
Thank you. I would like to ask the moderator to open for public comment on WebEx at this time.
We are open for public comment on agenda item 3 and the motion. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. And we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request, you wish to continue with the motion?
I'd like to confirm there are still no members of the public present at the Sacramento location.
This is board council Yiping Lin. There are no members of the public present.
Okay, thank you. There are no members of the public present here. So yes, I'd like to move forward with the motion. I'd like to ask Ms. Burns to conduct the roll call vote.
She is not here, but, okay, Gilda Dominguez,
Aye.
Amy White,
Aye.
Todd Borges,
Aye.
Tamara Chambers,
Aye.
Charles Sanders,
Aye.
motion passed.
Thank you. We'll move forward to agenda item 4, the DCA update, the DCA Board and Bureau of Relations. I would now like to ask Ms. Shelley Jones of DCA's Solid Team to provide the update.
Good morning and happy Friday. I'm going to share just information on just a few items this morning. The first one will be on the governor's reorganization plan. In January, Governor Newsom released his proposed 2025-26 state budget, which included a proposal to split DCA's oversight agency, the Business Consumer Services and Housing Agency, into 2 state agencies, the California Housing and Homelessness Agency and the Business and Consumer Services Agency. The proposed California Housing and Homelessness Agency, a mouthful, will oversee housing and homelessness solutions and safeguard civil rights, while the new Business and Consumer Services Agency will be responsible for consumer affairs, licensing, and enforcement. The Department of Consumer Affairs will be among the 8 departments in this new agency. As part of the process in state government, on April 4th, the governor's reorganization plan was delivered to the nonpartisan Little Hoover Commission for review. The submission of the plan to the commission began an approximate 90-day formal review process. The commission held public hearings on the 23rd and 24th of April to receive testimony and for interested parties to provide input on the proposed reorganization. Our agency's secretary, DCA Director Kirchmeyer, and other impacted department leaders testified in support of the governor's plan and responded to questions from commissioners. The commission is in the process of writing a report that will be submitted to the governor and the legislature. The commission's report will offer a recommendation to the governor and the legislature as to whether it believes the reorganization plan should go into effect. The commission sometimes offers recommendations for how the plan could be strengthened, either through administrative actions or subsequent legislation. The legislature will then have 60 days to review and consider the reorganization plan. The governor's plan becomes effective on the 61st day after it has been given to the legislature, unless either the Senate or Assembly adopts by majority vote a resolution to reject the plan. If it is approved, the Business and Consumer Services Agency will be created in July 2025 with 1 year of transition and will become operative on July 1st, 2026. In addition to several virtual briefings hosted by Agent Secretary Moss, there is detailed information available on the reorganization plan on the Business Consumer Services and Housing Agency website. We believe this is an extraordinary opportunity for DCA to better align with other consumer protection departments. A secretary within the governor's cabinet focused solely on consumer protection will only strengthen our mission, momentum, and delivery of services to California. DCA will continue to keep board and bureau leadership updated on the progress of the governor's reorganization plan. Next, hybrid telework transition. On March 3rd of this year, Governor Newsom issued an executive order requiring all state agencies and departments to update their hybrid telework policies for employees and increase from 2 to 4 days in office per week beginning July 1st. On March 13th, the California Department of Human Resources issued guidance on implementation of the executive order. The guidance provides defined parameters for when agencies and departments can make case-by-case exceptions to the 4-day in-office minimum requirement. DCA has been working closely with a few programs on identifying additional space needs for this transition. DCA has been hosting bi-weekly meetings with board and bureau leadership to provide updates and respond to questions. We recognize that this transition will likely require adjustments for many people, and we are working together to minimize the impacts. We will, of course, continue to keep leadership updated on any additional direction received from CalHR. And then finally, we have a new compliance and equity officer. On April 28th, Levi Hull began serving in this capacity. In this position, he's responsible for leading and coordinating department-wide quality improvement efforts to ensure consistency and regulatory compliance. This position oversees DCA's solid planning and training services, the Organizational Improvement Office, the Equal Employment Opportunity Office, and the Internal Audit Office, and also serves as the liaison to the department's Diversity, Equity, and Inclusion Steering Committee. As the department's equity officer, this position is dedicated to enhancing the diversity, equity, inclusion, and accessibility policies, trainings, and activities throughout the department's programs. Levi brings more than 12 years of experience in leading multidisciplinary teams and driving strategic program development. With more than 9 years of experience in EEO compliance and program management, including nearly 3 years at DCA, he is an experienced leader with a deep commitment to fostering inclusive, equitable, and accessible work environments. In closing, we just wanted to note that during the first week in May, we celebrate Public Service Recognition Week, and I want to close with a special thank you to the board, your executive officer, and board staff for all of your hard work and dedicated efforts to achieve our mission of consumer protection. We are grateful for your partnership and applaud the extraordinary service you provide every day. And that's my update for now.
Thank you so much, Ms. Jones. I'd now like to open it up for a board discussion. Are there any comments or questions for Ms. Jones at this time? Right, hearing none, I'd like to ask the moderator to open public comment at this time on WebEx.
We are open for public comment on the DCA update. If you'd like to make a comment, please raise a hand by tapping that hand button, and we will call on people in the order we have requests. We're going to take a few seconds to see if we have a request for public comment. Seeing no request online, do you wish to check with the rooms?
Yes, please. Are there any members of the public present for public comment at the Sacramento location?
There are not.
Okay, and there are none at our location in Glendora. Thank you. We'll move on to agenda item number 5, board chair's report. You can see that we do have our board and committee meeting calendar noted here. We met on February 21st, and we are currently in our second board meeting of the year, starting yesterday and concluding today. Our next board meeting will be August 21st, 22nd, 2025 via teleconference. And also on December 4th and 5th, that will be a location to be determined in Southern California. And we hope that we can coordinate having a meeting at one of the colleges that have SLPA program in our area in Southern California. We continue to have our standing and ad hoc committees meet. The members are listed, including any vacancies that are on those committees. There are 3 committees that met yesterday: the Hearing Aid Dispensing Committee, the Audiology Practice Committee, and the Speech Language Pathology Practice Committee. So we will ask the respective chairs to present an update regarding their meetings. So we'll go ahead and start with Mr. Borges to provide an update on the Hearing Aid Dispensing Committee meeting.
Thank you very much. The board met to discuss 2 items. The first was to essentially go over the language for the dome removal requirements and what needs to be done for hearing aid dispensers to be able to safely remove domes from patients. We went over essentially what we had before in what those rules will be. There was floated the possibility of opening up the training of the dome removal to other medical doctors other than ENTs. The consensus of the other members of the committee was that the other doctors don't have the expertise or the experience to be able to teach the dispenser how to remove the dome from the ear, and therefore the decision was to keep it as it is. The second was agenda item was to discuss regarding hearing aid dispenser training, supervision, and operations at primary and branch locations to try to give that better clarity of exactly what the rules are for that. Primary issue there was to ask the board staff to define what the term maintain is, to get better clarity on what that means in regards to the dispenser as it relates to an office where a trainee can work unsupervised. That was the gist of the committee meeting yesterday.
All right, thank you. Now I'd like to ask Dr. White to provide an update on the Audiology Practice Committee meeting.
All right, the committee meeting yesterday focused primarily on the discussion about whether or not our licensing board should be responsible for taking up the effort to sunrise a new license category for audiology assistants. There's been a lot of discussion about this over the last many years, but board staff did provide a number of documents and a lot of research about the sunrise process. And the committee came to the conclusion with all those documents provided that it did not seem to be within the purview of our board to take up the matter to sunrise that licensee category, and the recommendation would be for the state associations to take up that process, to go through the legislative process on that. The committee did vote on making a recommendation to this board to not take up the process, the sunrise process for creating that licensee category. And so I believe that will be agendized for our next meeting as a board to discuss that and take a formal vote on that. Additionally, there was a public comment requesting that the committee readdress or discuss an update regarding dual licensure for audiologists, with regard to being licensed as an audiologist and also as a dispensing audiologist, I think, and also asking about the California laws requiring audiologists to take a written exam, and if there was a discussion on what that written exam could look like or be changed to, and also requesting an update on the practical examination going away for audiologists. So I imagine those will be agendized for a future audiology practice committee meeting, or at the board level. I guess it'd be up to board staff and
Board chair can go.
board chair can decide. Okay. And that is the extent of our update for our practice committee.
All right, thank you. The Speech Language Pathology Practice Committee met yesterday as well. We discussed 3 items. The first was the scope of responsibilities, duties, and functions of SLPAs regarding the performance of oral pharyngeal swallow therapy with bolus material. We discussed the SLPA versus OTA scope of responsibility, duties, and functions, as well as education and training that is provided or not provided, essentially how they differ regarding swallowing therapy with bolus material. And next steps include initiating a conversation with community colleges, both programs regarding training and education that could include swallowing disorders, to make that in line with the role as a support speech language pathologist in care, and also to draft proposed revised language addressing SLPA SLPA practice restrictions. The next item, we reviewed and discussed the proposed text regarding the plan of supervision and whether or not to retain the language addressing alternative plans of supervision being approved, therefore including the option of requesting approval or that alternative plan, that will be removed. So to clarify, that option of requesting approval of an alternative plan of supervision will be removed for clarity. And a plan will be either approved to modify the plan, will be communicated to the supervisor by the board. The third item we discussed if SLPAs should be able to fulfill their CPP requirement from other providers and through more diverse course type options. And we concurred that this should be allowed, ensuring coursework relates to their work as a SLPA, and board staff will follow up regarding modifications. So I'd like to open it up for board discussion at this time. Any comments or questions? And hearing none, I'd like to ask the moderator to open public comment on WebEx at this time.
We are open for public comment on the board chair's report. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. We will call on people in the order we have requests. We're going to take a few seconds now to see if we have a request for public comment. Seeing no requests, do you wish to check in with the other rooms?
Yes, please. Are there any members of the public present at the Sacramento location for comment?
There's not. Nope, no members of the public here at the Sacramento location.
Okay, thank you. And there are no members of the public here at the Glendora location either. Okay, thank you. We'll move on to agenda item 6, our executive officer's report, and welcome Ms. Burns to your new role. Congratulations.
Thank you. So part of the update, the board did select me, Sharice Burns, as the executive officer at the February 21st, 2025 board meeting. The assistant executive officer position was posted, but will have to remain vacant until the next fiscal year due to higher than expected enforcement costs, which we'll cover in just a couple of seconds after I talk about outreach. Since the board's February meeting, I've had conference calls with representatives from the California Speech Language Hearing Association and the California Academy of Audiology at their request, discussing issues affecting speech language pathologists and audiologists. In March, board chair Gilda Dominguez and myself spoke at the, I'll just say CASHA Convergence Conference to provide updates on the board's laws and regulations related to the requirements for continuing professional development and supervision of speech language pathology assistants. We also talked a lot about the continuing professional development audits, and that was a very well attended presentation, and it was at no cost to the state. So I was here at the board office remotely, and the board chair was there on her own personal dime. And the presentation was well attended and also got a great feedback from many of the licensees. It was also really informative. They said about the regulatory process and when to chime in, and then also about the continuing professional development audit and how that works, and kind of the tips on how to pass your audit there. During the question and answer section, the board got 2 questions, one related to RPE temporary license holders having documents countersigned by their supervisor, and the other related to a delay in a professional development provider application. So at the board chair's request, I'm going to kind of cover those a little bit just as educational components. In relation to countersigning, California Code of Regulations 1399.153.3F requires the RPE supervisor to review and countersign all evaluation and assessment reports, treatment plans, progress, and discharge reports drafted by the RPE temporary license holder. So these regulations do predate electronic signatures of documents. However, the concept's still the same. Supervisors should work with their employers to ensure that they are able to review and countersign all required documents during the course of their supervision, and then keep a copy with their RPE supervision folder. That's along with other written documentation that's required of the RPE's evaluation and performance reviews. So kind of simply figure out a way to make sure that you can countersign those documents, whether it's adding an additional signature or an additional initialing on there, make sure that gets done. In relation to the question about the professional development provider application, we actually wanted to just kind of highlight, because we get this often where we get not really a complaint, but someone wants to bring it up. But oftentimes when we go and look at that, we find out the application didn't have all the required documentation. The applicant failed to respond timely to the board. So we really want to make people aware of the fact that, you know, our new online licensing system is built to collect almost everything you need for licensure except for the transcripts from your university. You still have to go get fingerprinted, but everything else kind of comes in through that portal. So when the board sends you a deficiency email that says, hey, we don't have this document, you didn't supply it as part of the initial submission, we need you to promptly answer and provide the actual document we requested. So oftentimes, if you're not following up on those emails, you're not going quickly, it can take a while. But if you're responding to the board quickly, you ensure you submit all of the necessary documentation at the initial submission. Generally speaking, you can be processed within 1 to 2 weeks. And even if you're deficient, oftentimes within 3 to 4 weeks. So longer delays, always, if you think you have a delay that's longer than that, double check your spam, check for those emails, make sure what you sent us is what you think. Make sure, I'm not going to say copy a picture of your cat, but make sure what you uploaded to send to the board is the right document that the board requested. And that can ensure that your application is processed efficiently. So next up is the fun topic. I also have on the call with us as well, Andrew Trout and Nicole Dragoo from DCA's Budget Shop. And they are here to help with answering any questions you might have while I provide this report. So the board continues to actively reduce expenditures and closely monitor spending, and that's in alignment with the governor's 2420 vacancy reduction and 2424 budget efficiency reduction requirements. So part of these reductions are going to impact board operations, travel, and of course, as we already have, we have 2 remote meetings this year and 2 in-person meetings. That's going to be our future plan in order to achieve those savings. The board doesn't have a whole lot of discretionary funding that we can trim. So this is one area that we were able to do that. One of the other things, of course, is that, you know, part of the vacancy reduction is we didn't have any positions that were funded to give away. We were already full. And when you're full, you still have to pay your fair share, essentially. So we do have to have that money go out of the board's budget as well. The other part of this is a plan, and that's why we wanted to talk about it here at the board meeting, is actually to move licensee renewal notices. So every time you're up for renewal, you get in the mail a nice big envelope with a bunch of pieces of paper, sometimes some inserts and different things in there. All of that is the renewal notice, which is it's a complimentary thing from the board and like to remind you, but technically we don't have to provide you the renewal form. You can go online. And it turns out that about 80% are not. So we're paying to send out thousands of envelopes stuffed with things. It costs us to print. It costs, we have to pay the printing company to do all the sorting and the combinations. All of that, and 80% essentially are tossing it in the circular file, right? They're tossing it in the recycle bin because 73% are renewing online and 7.7% are renewing manually and sending us a manual downloaded from the internet renewal here at the board's office. So in general, we're wasting quite a bit of money on sending out a big renewal notice with multiple pages when that's not really the avenue most people are going. So what the board is doing now, and we'll be moving there this fall, is to send out a renewal postcard. So just like you would get a postcard reminder in the mail, hey, you need to come in for your optometry appointment, right? You're going to get a postcard renewal notice that says, hey, this is your license number. Your renewal date is this. Go online to renew. Now, you still have the options to go to our website and either renew online or download the manual form, but you'll no longer have that multi-page packet that you mail into DCA to process. So this will save the board. The original guesstimate was $7,000 savings, but actually most boards are seeing more since those estimates were based on earlier projections. So we're expecting somewhere around 10,000 hopefully in savings every year, especially as we continue to grow. So that is way less in mailing costs, postage costs, and then paying way less for the printers, right? Because we're no longer having to have people manually put different mailers in all of our things. So those are all additional costs the board will no longer have. Now, that's all in general for the budget reductions overall. But this year in particular, due to higher than average enforcement cases being adjudicated and heard at the Office of Administrative Hearing, the board is going to overexpend in the Office of Attorney General expenditures, and we're going to fully expend our Office of Administrative Hearing expenditures. So as I've said before, this is actually one of the few areas where if the board overexpends in this area in the enforcement function, we can request an augmentation. Now, an augmentation still comes out of our budget, so we're not going to the state and asking them for money. We're taking it out of our fund, consider it a savings account, right? That's where all the licensing fees go. So we ask for an augmentation, and that augmentation adds to our budget to cover those over expenditures. Now, included in your materials is what we're going to show, but let's start with the fact that right now, as of, I think, a couple of days ago, we got the great news that our AG augmentation was approved. So I am very happy to report that our augmentation is approved. We should be fine with that augmentation. It will be tight. So we are watching all of our expenditures. We are not buying anything that's not absolutely necessary to function at the moment. But we still will have a nice little tiny sliver of a reversion of 0.19%. So about $6,000 left over at the end of the year. But as I think myself and our former EO would say, the core mission of the board is consumer protection. And the two complicated cases that right now are eating up a lot of the funds, if we can't prosecute in those situations, then I don't know what we're doing here. So I think it's worthwhile that we look at what we're prosecuting, but in this case, it's very much warranted. And I'm not going to say happy, but I'm glad that we can come to the task of prosecuting these, even if it takes having a tiny reversion and asking for a sizable augmentation in order to cover it. So that is just sometimes the cost of doing business. Let me go back. Pages. As you'll see on the next page, though, since I already took you over to the budget page, the fund is looking very healthy. We continue to grow. We continue to have a great fund and plenty of months in reserve in the out years. So there's no concern there. But that is the report. So that is also why we will not be filling the AEO position until the next fiscal year. We're not replacing a laptop. We're kind of making everything work as much as we can. We're going to make it through with that sliver of a reversion. So that will get us through there, and then we'll continue on. Of course, the governor did just come out with his May revision. I haven't had a chance to look at it. I don't know what will be coming, but we will always be ready to do everything we can to trim down what little we do have discretion over in order to not impact services as much as possible. So that's where we will continue to go. In the regulations report, of course, we have many regulations that have been going through over the last 2 years. We have the current ones of processing times and clinical requirements for audiologists that are going through. And then we are working in the enforcement committee on disciplinary guidelines. But those are the reports for that, but I'll leave the more detailed report for Maria later on. Licensing. Licensing, I'm very happy to report continued success. Overall reduction of 69% in processing times. As you can see from the chart, we're still holding steady at 1 and 2 weeks over the last 2 years. These are great reductions. Happy to report they continue to be steady and we continue to see improvements all the time. That's it for licensing. practical examination, we actually have the results from the January and the April examination. So as you can see in there, in the January exam, we had about a 74% passage rate, and in the April exam, an 80% passage rate. And then we are holding the next practical examination on June 13th and 14th, and that filing period just ended on May 8th. So continue to move on, and thankfully our budget is healthy enough we can continue to hold our exam. And enforcement report. This one, actually, I would highlight is we've actually received 217 complaints and subsequent arrest notifications through the end of the third quarter. So during the same period, the board's issued 13 citations and fines. We have 11 formal discipline cases pending at the Attorney General's by the end of that quarter. And the board is monitoring 14 probationers, 6 of which have drug and alcohol testing and 3 which are told. And then in the last 12 months, you'll see a nice uptick in the amount of enforcement actions we've taken, some revocations, some voluntary surrenders, and a little bit of probation in there too. In general, I would point you to the enforcement report in the back with the data. It is looking like we are going back up to the prior levels pre-pandemic. So during the pandemic, the number of complaints was significantly reduced, and the number of convictions, criminal convictions, was significantly reduced, and that has slowly been ticking up. So we will see if that holds or if it's just that there's more in this year, but it's worth noting. We've also had a good number of closures of investigations, and we're holding kind of steady at the 180, 190 average days to complete a desk investigation. So that's also great. Other than that, just worth noting, we continue to take all the necessary actions when violations of the law are found. In relation to the CE and CPD audit, those are a big one, and it has been interesting, of course. So back in December, the board completed its first continuing education audit, and the first audit and all of the audits are 5% random sample of speech language pathologists, speech language pathology assistants, audiologists, and hearing aid dispensers. That one was for the month of January. The results for January, February, and March audits are all provided in the table. And then on May 6th, we sent out the next round of audits, which are April, May, and June of 2024. And that's 129 audit letters that we have sent out for those. And as you'll see, we're having a not the most amazing passage rate, but January was 61% passed. February, 55% passed, but in March, it was 48% passed. So we are seeing quite a bit of difficulty. The licensees not understanding CPD requirements, licensees not having the documents from their CE and CPD. And then a lot of it just not always keeping great records, a variety of things, including not understanding we have exemptions for when a licensee has been disabled or caring for someone that's disabled, and requesting that exemption from the board so that way we know that you qualify for the exemption and you did not need to complete CE that renewal cycle. So those are my report items. They should also be available on the website today. And I will open it up for board questions.
I have a couple questions. Just remind me what the fiscal year is. Is it the same as calendar?
No, July 1 through June 30.
Okay, so the assistant executive is really just until June. So we're only looking like another month.
But June 30, so July.
So July, 2 months
Yep.
before you start looking. Okay, so that's not that. And I'm also curious, when you're looking at the amount of money that you save by going to the postcard, does that number factor in the man hours difference?
It is estimated based on the reduction in cost of the printing, but do you mean man hours for process?
So, yes, so not just the physical money you're saving physically by switching, but also the time that you had to put in to stuff everything and put everything together.
That,
I'm just
that,
curious if that's factored into it.
that is included in there. But they use numbers, I believe, for renewals from a year or two ago, so that's increased as well. So it should be closer to about 10.
Okay,
And other boards are finding it's helping people to move to the online system. So then we're seeing a reduction altogether, right? So less processing time, less mailed stuff. So
thank you. That's all I have.
any other questions?
Is there an option for them to opt out of even the postcard to go to truly paperless and or get some kind of electronic notification rather than having to manage the postcards at all?
Not currently. We are on some old legacy systems for our licensing database. And so that does not currently have any sort of email reminder system. But as always, in my head, I have a long-term plan to eventually get us into something that would allow us to send you an email reminder and a system that would allow a more advanced online renewal that might also include you could upload your CE at renewal. So eventually we hope to get there. Although my guess is the state's not going to have any grant money for me to look at these opportunities in the next year or two. So we might just have to wait it out for a bit, but hopefully.
Is that something that would be a part of like a sunrise or a sunset report, or is that just something you're trolling for grant money and when you get it, then you jump?
Since our online licensing system, we found out about that. It was the first time the California Department of Technology had a technology modernization fund grant process. So that's how we actually got to do our online licensing system.
Gotcha.
We got to pay all vendor and creation costs right there with that money instead of the board's money. So that saved our fund from essentially being drained for quite a few years. So my hope is that eventually when the budget looks a little nicer for the state, they'll continue doing those modernization fund grants and that the board can access that later. There are other boards that are also looking at updating their renewals, their online licensing, and of course, they're a lot bigger than we are. So of course, if there's any way for us to tag along within our budget process, we'll do that as well. But you just kind of always have to be on the lookout for your long-term plan around here. So just kind of keep it in mind. Any other questions? I also have our budget analysts on the line if you had questions for them. So you're all good.
Actually, I did have one other question about the audit process.
Mhm.
So each month it's gone backwards. Every month you're auditing 5% of individuals that renewed in 2024. So each month we're going to see this number.
She's running one audit of 3 months at a time, but each month it's 5% of that renewal month. So it's a random selection of
Okay,
5%.
so whoever renews in.
Yeah.
So these are 5% of who renewed in March of 2024. That
Yes.
they had. Okay. So we get to tell them a year later. Well, by the way,
I would suggest that that's not too bad. At my last board, we had the ability to renew or to audit 4 years in arrears. So if it could be any more confusing, we would always be quite behind and looking backwards. And so then, of course, you're saying, I just sent it in. Here's this. And you're like, no, not this last renewal. I need 2 renewals ago. Like, send me that document. So at least right now, we're just last year. So at least for most of them, they have access to their records. Some are having some difficulty. They didn't keep very good records. They just can't find all their certificates. Some just really didn't understand the requirements. And some didn't understand that we're not ASHA and that we have our own board requirements and you need to be aware of them. So it's kind of been a mixed, interesting bag.
And I think the plan, right, is to, just like what happened at CASHA, being able to show up to those state associations, maybe HHP, I don't know if they've reached out yet, but to talk about CE requirements and kind of highlight the errors that are being seen now that we are auditing again to try and help licensees understand what they need to be doing.
And that's kind of the hope. So I think there's been a lot of confusion on live versus or self-study versus not self-study. So what counts, what doesn't. So going over that during our presentation was helpful at CASHA. CAA has reached out, HHP hasn't reached out, but hopefully might.
I was just gonna say, I'm guessing they didn't reach out before they just did their conference, which I think was just last month.
Oh, okay.
So.
So maybe next year.
Okay.
And those citations carry a fine with them or just a?
They can.
Mhm.
So somebody can get an educational letter if it's extremely mild. There's also citation and fine or just a citation. Either way, they're going to have an order of abatement, and that order of abatement is going to require that they make up that CE, and they can't use that towards the next renewal, so that's separate. But most of them have a citation and fine, and it's kind of in a weighted system of depending on how many hours you're missing. Some it's just very minor, and some it's a good chunk of the continuing education.
And is this on the website where someone can look and see, okay, what's gonna happen if I don't keep my CEs current and what the?
I don't think we've gone over that part of the
'Cause
process.
I think it would be nice for some people to actually see, oh, okay, if I'm looking something up, I can see, oh, if I don't do it, these are the consequences. That might,
We can
maybe
add that
kick a
in.
few people in the rears
Yeah,
to pay a little more attention if that was a part of the website.
like not just the requirements, but hey, if you don't,
Right.
this could be.
Understand the consequences of not keeping record, essentially what comes down to not keeping records. Or just not doing it, but let's just say not keeping records.
With that
try again.
record,
Go ahead.
or what the expectation of that record is expected to look like.
Yeah,
Yeah.
I mean, I want them to have a chance to succeed, right? And it's so they can say, well, I didn't know that. Well, it's right there on the website. So I would like to be able to take that excuse away.
Absolutely. You can add more to the website. I'd like to add more, including even
Good
some
idea.
graphics, because I think people, when they're signing up, aren't paying enough attention. They like the title, they want to take the course, but they aren't paying enough attention to, oh, well, this is another self-study, asynchronous learning opportunity. That's fine, but you can only count so many of those
Right.
towards your renewal. And even on the hearing aid dispensing side, right? We had some people that, oh, well, I took them all on audiology online. If that's okay, right? Well, no, you need to
It
make
wasn't live.
and you also need to make sure it's approved for hearing aid
Right,
dispensers,
exactly.
right? So,
You gotta hit the filter button for.
yeah, so
DA had me.
and that's
Yeah.
where people are kind of missing some of the details. So even talking them through that it's an educational experience. So
So, shame they changed peanut. Just out.
someday.
All right, any additional further discussion before we open up for public comment? Hearing none, I'd like to ask the moderator to open public comment on WebEx at this time.
We are open for public comment on the executive officer's report. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen, and we will call on people in the order we have requests. We're going to take a few seconds now to see if we have a request for public comment. Seeing no request, you wish to check in with the other locations?
Yes, please. Are there any members of the public present at the Sacramento location for public comment?
There are no members of the public at the Sacramento location.
All right, thank you. And there are no members of the public here at the Glendora location. All right, we're moving through. We can go ahead and move on to agenda item 7 at this time. I'd like to ask Ms. Lorenzo to provide the legislative report.
Thank you, Ms. Dominguez. This is our first legislative report, and as you can see, we're far along the legislative calendar. Today is the last day for Policy Committee to meet prior to June 9th, and next week will be the last day for Fiscal Committee to meet prior to June 9th as well. In the coming weeks, the legislature will have floor sessions to report bills to the other house that were introduced in their house. The next item on the report is board sponsored legislation. This is the DCA's omnibus bill. It is currently in the Senate Appropriations Committee with recommendation to the consent calendar. This bill will replace gender pronouns with non-gender pronouns and replace the board's former name with its current name. We do have many bills on the watch list that may be affecting licensees in private practice. I do want to highlight 3 that may impact consumers and or the board. AB 45, privacy, health data, location, and research. This bill will prohibit geofencing or selling of sharing personal information with a third party to geofence an entity that provides in-person healthcare services in California for specified purposes. It does a lot to reduce, to essentially protect consumers' information from third party. The concern, if we looked at the text, the item for concern that maybe dispensers may want to talk to their manufacturers would be to it's section 4, section 1798.99.2. The language may be broad in that it may interfere with maybe location collection from hearing aid devices. I'm not sure, I'm not too familiar with that. So, but I assume as advancement technology has increased, there might be hearing aids that collect data so that when you enter different places, it changes. So this law may cause some issues when it comes to if that information is being provided to the manufacturer, which they are considered third party. So that's something we wanted to bring up, especially for the dispensers on the board for discussion. We also have AB 485 regarding license renewal for denial of non-payment of wages. The bill would require the board to deny license renewal if the licensee is found to have not paid their wages to their employees. The concern with this bill is that we don't deny renewals. We could put a hold on renewals. And so we're working with DCA to see what we can do to change it so that's similar to holds we currently require for child support and taxes violations. And then the last one is AB 641, which will give the board authority to authority for state of emergency. For this bill, it will allow board to delay certain renewal requirements and things like that. We just wanted to bring up that it doesn't require regulations, so we are looking at if it's chaptered, that it would probably be something the board need to discuss and adding it to its administrative procedure manual. But those are the only 3 bills we thought were of importance. We recommend the board to review and discuss the provided material and ask any questions on any items on the report.
I have questions. Do you have questions?
I just have one simple one. I'm a simple hearing aid dispenser. So you want to tell me exactly what geofencing means? Essentially, you're blocking off or.
No, geofencing is collecting location data.
Okay, so you're finding someone. You're basically triangulating.
So hearing aids use it all the time,
Yeah,
right?
exactly.
Like to switch automatically into a different program.
Yep.
So
Well, just to find my hearing aid, it's tracking it consistently.
yeah,
And it does give them the option of
More
do
advanced.
you want to send information to the manufacturer about what's going on? So yeah, all that stuff.
And more advanced devices can actually then remember where you've been.
Right.
And you can select that in your programming and in your app to say that next time I return to this exact location, make my hearing aid program.
Adjust my
this exact-
program to
To
this.
the way that I want it.
Yeah. It can be very specific.
The question is that information is privacy information being sent to the manufacturer or just data? Is the patient being identified by name or in any other manner, or is just the data of this type of sound environment? The user chose to do these changes. Is that data going, or is there personal data going?
like identifying PII patient,
Right.
like protected.
Protected
information.
Only the manufacturer can tell us that.
Yeah. So I think that was highlighted for good reason, that bill.
Yep.
That can have a lot of impacts, is I think as dispensers,
and dispensing audiologists, we probably don't actually know all of what's being sent. And then how do we deactivate that as a feature if this were to pass, for example? What is our responsibility then to make sure that those features are deactivated in the hearing aid? And what do we do if we can't, as the provider, deactivate it and the patient can then go and reactivate it on their own? And then what are our responsibilities when that happens? Because
several of the apps have that option to do not send information to the manufacturer. When I'm setting up the app, I always select it, do not send.
I do as well.
But
the
the
user
patient
can
can change
undo
it.
that at a moment's notice and the accident.
Yep.
Very easily.
Or on purpose.
So it comes down to our liability.
Mhm.
Correct.
So I think that's an important one. I think 364 looks similar, AB 364.
Yep.
Which is on page 3 of 13. Bill would also prohibit a business from maintaining personal information as healthcare information, financial information, or geolocation data in the custody of a foreign government or third party that is owned or controlled by a foreign government. And in the case of hearing aids, almost everything is owned by a foreign country. Almost all hearing aids are produced outside of the United States. And so it's the same kind of relationship. Or they may have a US office, sure, but they actually are based in Switzerland or Germany or wherever. So I think that one is similarly related.
No, it is. I wasn't sure if anyone keeps data outside the state, but it's good for us to know that hearing aid companies are. Yeah, so it's definitely something as dispensers, you need to probably reach out to manufacturers to see
Where they store.
Yeah, where it's being stored, how it's being in store, how it's being used, because the law does say they can't use it for notification of health services or advertising as well.
Well, in both laws, this is the business. As a just licensed dispenser, that's the initial business. And the dispenser is not keeping that information.
Right.
That information is being sent on to the primary manufacturer of the product outside of the licensee's control. Who's responsible? The licensee or the manufacturer? That's what Todd was just saying. The liability in our concern needs to be with the licensee and the consumers of California. So are we gonna get in trouble?
Right. We're not collecting it or keeping it, but are we going to be made responsible for
We
that?
stole
act?
it.
Right.
We can definitely look into.
Yeah, we'll have to look into it.
And then I think same on AB 410, which is page 4 of 13, with the bots. And making sure that you're identifying that you're using a bot to talk to a patient. I mean, I know a lot of the practice software now includes, that discussion of scheduling your appointment or moving your appointment, and it's all bots doing it. Which is okay, but I think it's just something that we would want our licensees to pay attention to and be aware of if that passes, because I think a lot of people are starting to use that or are already using that. And then same question, I think a lot of the manufacturers have that, like a built-in help.
Websites.
Yeah, and that, I bought my Oticon devices from Dr. White's practice, and now I'm using this bot to interface with Oticon. So this shouldn't be Dr. White's problem, it should be Oticon's problem, but.
And as AI becomes more sophisticated and capable, this is only gonna get bigger.
Right.
Yes,
Which is why they're doing it.
Yeah, this is why we're bringing it up, because a lot of the bills are addressing AI. And so making sure that it doesn't create implications to the consumers of hearing aids is the reason why we brought these up.
Yeah, and 489 on the next page, same thing.
I was just gonna say that. I was just reading that. I'm like, well, this actually.
Same, the generative AI.
49 as well.
AI.
Yeah.
And the same, because some of the software I know can provide the consumer like, oh, they're texting, like my hearing aid's not working. And the bot will say, well, like, have you tried changing your filter? Have you tried changing your dome? Have you tried, so is that being construed then as I'm talking to a hearing aid dispenser or an audiologist? I mean, I guess for 489, that's what it's saying. Like you need to make sure that they don't think they're talking to a licensed person of some sort. So it's another one to be careful of. And then on 667, the next one under that, do we have an ability to how would we meet that requirement if that were to pass on having an interpreter at tests?
Probably a contract.
Okay.
And it's very, I mean, we were looking at the data and we rarely get requests, for, interpretation.
Does anyone have more information or understanding what 784 means? AB 784 on page 6? It's very vague.
It is, that's why we're keeping an eye on it. I think there's probably confusion in the schools of the terms being used. I'm not too familiar with the school, so this is more for anyone who's audiologists probably working in schools.
And it's talking about special education, how it's defined at no cost to the parent. Includes definition of speech language pathology services and certain other services if it's considered special education. I'm having a hard time understanding what it's doing. I definitely would like to understand more about that. It's specific to including deaf and hard of hearing related services. As these, I just don't understand how it's written. I'm having trouble with that one.
I think like I said, I think it's just clarifying the definition because it might be getting confused, in schools.
Which part's getting confused?
Just the definition, if it includes,
Deaf and hard.
yes.
Yeah.
Prohibit from being construed to prohibit an IEP from including. Okay, so it's preventing prohibition of including specialized deaf and hard of hearing in an IEP.
I think some people think the current law is prohibiting it and they're saying, no, it's
No, it's
not
not.
prohibited.
Okay,
It can
so
be
just
part of it.
Clarifying.
Clarifying, yeah, that
Okay.
it can also include,
Not very clear, doesn't it?
Okay,
yeah, that's the legal way or
okay,
statutory way of writing it.
okay.
Yeah, like I said, I'm assuming there's confusion in schools about if those services are included or not.
Okay. And then the AB 970, the mandatory reporting, there's going to be a new process they're piloting.
Yeah, for those in LA County,
Uh-huh.
new program provided by the county. So that's something for those licensees in that area should keep an eye out of seeing what that's gonna look like and how it's gonna impact them.
Do we know, is the pilot going to be compulsory for everyone in LA County, or are they gonna opt into it? Or are all mandated reporters in LA County gonna have to participate?
We don't know.
Don't know.
Yeah.
Okay. That would impact all of the SLPs and audiologists down there
Mhm.
and dispensers. Yeah. Okay.
I just also want to highlight 641 again. So, part of the interesting part of this is I just want to make sure we understand this isn't just so that the board can then waive requirements.
SB 641.
That's be.
SB 641. So it is very specific about what we can do in that declared state of emergency. So essentially we can delay your renewal. When it says licensure renewal deadline or continuing education completion deadline, that doesn't mean we can waive your renewal fee or waive the CE. We can delay it. We can't waive it.
Mhm.
So it's interesting to give us new authority on it. And we'll have to figure out a way that if we're going to implement it, how we do that at the board meeting. Does the board chair approve it, but then the board needs to approve an extension? We'll have to figure out how to work it, but it's just, again, I just wanted to make sure everyone's aware it's not waiving. It's not a carte blanche, you can waive your requirements. It's very limited.
Did the board take any action like that during COVID?
No, everything had to go through DCA. So the governor, through executive order, gave the Department of Consumer Affairs the authority to waive certain requirements. And the board applied to DCA and said, we'd like these things waived. And then DCA determined if and how to waive it.
Okay.
So, but again, so going back to the CE audit, many people thought, oh, but you changed your requirements during COVID. And I said, no, the department waived you having to do them until a specified time, at which point you were supposed to make them all up. So I think there's been a lot, even though we thought we were very clear in our communications, but That didn't get through. That message definitely didn't come through. A lot of people thought, oh no, we just got to do all self-study during the pandemic. That's not true. And we also didn't change our regs during the pandemic. DCA waived certain things and it was essentially to delay it. So you don't have to do it now, but you have to do it later and make it up. And so that it's helpful to also like keep it in context, right? So this legislation would give us some limited authority to delay certain things for licensees that are impacted by states of emergency. So
So many conversations about that waived versus delayed. Oh, you gotta keep doing your courses.
and that's where I was like, I don't think people are quite getting it,
No,
but
a lot of people weren't getting it.
Yeah,
I can
that's
tell
my
you
guess.
from personal experience.
so and you know, I want to, the point is to make sure our licensees are completing the continued professional development to, keep up your competency. The point is to make sure you're doing it. We could have audited further back, but I didn't want to touch the pandemic time because I just know there was too much confusion about it. So we just weren't going to go that far back. Start in 24 when things were
Then
more back to
Then
normal.
it starts to become a little bit punitive, almost like we're gonna catch it.
So. Were there any other board member questions about the legislative items?
All right, hearing none, I'd like to ask the moderator to open public comment on WebEx at this time.
All right, we are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. And we will call on people in the order we have requests. We're going to take a few seconds now to see if we have a request for public comment. Seeing no request, you wish to check on the other locations?
Yes, please. Are there any members of the public present at the Sacramento location?
There are no members of the public at the Sacramento location.
Thank you. And there are no members of the public here located at the Glendora location. So we'll move to agenda item 8, legislative items for a future meeting. I'd like to ask if there are any legislative items for future meetings that need to be included. Ms. Lorenzo, are there any legislative items for future meetings at this time that you want to mention?
We do have a couple, we're just bringing
Grabbing them up right now. Okay. AB 1355, another one on location privacy. SB 82 on contracts, consumer goods and services, and dispute resolution provisions. SB 294, the Workplace Know Your Rights Act. And SB 747, wages, behavioral health, and medical surgical employees. So those will be ones that might potentially merit a watch or more information.
All right, thank you. I'd like to open up for board discussion. Okay, hearing none, I'd like to ask the moderator to open public comment on WebEx at this time.
We are open for public comment on agenda item 8. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of your screen. And we will call on people in the order we have requests. We're going to take a few seconds now to see if we have a request for public comment. Seeing no request, you wish to check on the other locations?
Yes, thank you. Are there any members of the public present at the Sacramento location for comment?
No, there are no members of the public.
Okay, thank you. And there still are no members of the public present with us at the Glendora location. Okay, we'll move on to agenda item 9, update and discussion on the Audiology and Speech Language Pathology Interstate Compact. I would like to ask Ms. Burns to provide an update on the compact.
Okay, so board members had requested an update on the interstate licensing compact for audiology and speech language pathology. It is the Audiology and Speech Language Pathology Interstate Compact, the ASLPIC. A presentation was made to the board back in May of 2022. And at the time, the compact did not have enough members even to be formulated and operational. They do now have enough states that they are up and running as a compact, but they are not yet operational and issuing licenses. The information available last updated was February 2025. It's on their website, and they are expecting, so
Late summer,
late summer, yes.
Bottom of their page one.
Thank you. I'm like, my eyeballs are skipping over here. So they do have the 34 states and 1 territory, and they'll start issuing those. They expect late summer 2025. The guess is that we should probably have them come out to the board maybe next year to also give us a presentation on how it's actually working, how their operations are going, costs, all that. The board has been looking at the compact and the issues related to it. And part of that is in our strategic plan, which is somewhat perfect timing, right? The following issues are the ones that the board staff are currently most concerned about. And then, of course, as they become operational, we'll probably have other questions. But right now, those costs involved to join the compact, including workload dedicated to statutory and regulatory changes, the compact's impact on the board's jurisdiction to discipline individuals who violate California laws while providing speech and hearing services to California consumers, and then the compact's impact on the board's enforcement procedures, workload and cost, essentially without adequate cost recovery. So in their presentation back in 2022, part of it sounded like we would be sharing essentially some of our investigative materials with them, but that's all cost to us. So we would create all of these costs of which there is no cost recovery for. So currently, if we take action against a license, there's a cost recovery component, right? You're either paying it back during your probation, or if we revoke you, you pay it back if you ever decide to request reinstatement. That helps cover some of the costs so that general licensees that are not violating the law are not stuck with the total cost of our enforcement. So if the compact is just essentially revoking a privilege to work in the state of California and it's theirs, how do we get reimbursed for all of our investigative time? Because they're not going to complain to the compact. Consumers aren't going to go complaining to the compact about somebody. They're just going to say, I saw this licensee. And the board's going to have to figure out what's all going on, do part of the investigation, because it sounds more like we would do the legwork and then share it. So if we're going to assume the cost and all this man hours, but we're not going to have adequate compensation, we could have a problem there. So those are kind of the general ones. And then the other part being, of course, right now, if we take action against a person's license, that's public information. It is also reported to the National Provider Data Bank. If we're not the ones taking action and we just hand all this investigative material over and it's just to the compact, what happens then?
And those are all questions
We don't
I was on that meeting, but it was a long time ago.
Right?
Yeah, that they weren't able to provide a lot of that. I know there were a lot of questions around that. And I guess the hope would be with this many states now that have signed up, raised their hand, that some of that's been
They've worked through some of those.
right. So I think I agree, like having them come back and represent where we can ask all these questions. And,
Find out more from nitty-gritty.
Mhm.
Because as it stands, I mean, the other point being, right now, when we take action against you, we have all that information. And we use it as well when we determine if you try to come back, we have the previous information. If we're also not going to have any of that, there's all like question marks, right? So you violated our law, so the compact took your privilege, but then you come back to apply with me. Well, what do I have? I don't have any recourse started. I don't have any process started. I have to start all the way over. So there's some interesting questions when it comes to enforcement, and then the board having some amount of workload that are we even getting covered? So Many things to come. I'm sure they will have started working on this as they have their meetings with the 34 states. So, many of which are somewhat smaller states, so that may also impact the way they wish to operate.
Yeah, but looking at the list too, I can see a couple off there that I know, at least on the audiology side, tend to be have pretty robust rules and regulations around what audiologists can and can't do, and do a lot of enforcement. So, it would be interesting to see
What they come up with. Yeah. So to be continued, but that would be my best suggestion is to have them come present sometime next year. It'll give them hopefully, you know, if we do it summer or fall, about a year of operations to start hearing what's going on. So. Are there any other questions?
Do you recall, I mean, there are other professions that have such things, right?
There are
Interstate compacts amongst other professions.
The bar.
How it works.
well, there's for most of our healing arts, we look at BRN has a compact, Board of Registered Nursing, sorry. The nurses have a compact, and I believe physical therapy also has a compact. I think it's active. Don't quote me on the physical therapy. I know nursing there is.
And that's kind of what allows for like traveling nurses and all of that.
There's a lot of things that allow traveling nurses, but yeah, it's a whole different ball of wax, and I don't know a ton about it, but it is, they're at least already been operational for quite some time. But interestingly, many people apply for licensure in California still, so, yeah.
Did they say anything about information sharing from other states back to, you know, within the within the compact? Like if somebody gets a DUI in some other place, is that shared? Is that gonna be available to California as well?
They did not have that level of detail.
Mm-hmm.
I would tell you right now, we get subsequent arrest notices for licensees in the state of California. We do not get a federal rat back, is what it's called. So when licensees get fingerprinted, we get that initial federal search, but we don't get it after that. I know that's something that many boards have always wanted, but it's just currently it's not technologically and possible for DOJ to help boards with that at this time, so.
Would it be reasonable to develop a series of questions and start requesting information from the compact to see if they have any of this figured out or dialed in before we even have them come present?
So it's not a waste of time just to have them come over to say, we don't know, we haven't looked into that yet.
Well, or
You could, I would hope they would address this in their bylaws at this moment, but,
If we give them the information we actually want, then they can come prepared.
we could develop questions.
I know that this is a top of mind, right? It's a big ask for the licensee population here.
That's putting a lot of workload into asking the questions, but sure.
Too many, we should just wait to be presented with what they
I
have.
think you should just wait to be presented. If they're not doing adequate work on their end, then we'll know it by the presentation. And then we can sit comfortably in our currently regulated environment. But that's just my own personal thought on it. It's always up to the board and your guys' purview to direct staff to do research.
I think that makes the most sense, see where they're at, and that gives you the idea of what their commitment is. And then,
I mean, especially given that they're anticipated to begin issuing privileges to practice in late summer 2025. That's right around the corner.
And that's just only a timeline with IT projects. They can also get delayed, so that's something we'd have to monitor.
Mhm. Any further board discussion? Okay, now I'd like to ask the moderator to open public comment on WebEx at this time.
We are open for public comment via WebEx on agenda item 9.
You need to give the moderator a break.
If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand. We will call on people in the order we have requests. We're going to take a few seconds now to see if we have a request for public comment. Seeing no requests, you wish to check in with the other locations?
Yes, please. Are there any members of the public present at the Sacramento location?
No.
Okay, thank you. There are still no members of the public at our Glendora location. So I wanted to propose before moving into agenda item 10 that we take a 15-minute break at this time. Is that okay with everyone?
That would be perfect.
Okay, thank you. We'll return in 15 minutes. All right, it is 10:35. We are on agenda item 10, so we are going to reconvene our board meeting and start with that item. Item 10, discussion and possible action to review and revise the board's administrative procedure manual. Before we discuss, do I need to make sure that everybody is present in the Sacramento location?
Everyone is here and there are no members of the public here.
Okay, and we are both here, myself and Tamara are here, and there are no members of the public with us. So we'll proceed with discussion on that possible action to review and revise the board's administrative procedure manual. I would like to ask Ms. Burns to present information on the administrative procedure manual at this time.
Thank you. So the boards and bureaus adopt administrative procedures manuals to provide guidance to board members and also to provide transparency to the public about how we operate. We were in the middle of revising it. It's always a good idea to take a look at periodically, and our look at it was actually very helpful in that we should revise some of the enforcement or complaint and disciplinary process in Chapter 7, as well as, I believe, update our vision, or there was one other update that we had missed on there. So we have gone through, Maria and myself, and read it, gone through that Chapter 7 quite thoroughly, and hopefully you like all of the information. We tried to make it as kind of clear and concise as we can, and to keep it more simplified. Including kind of like the order in which it went, so it didn't feel kind of stunted or duplicative. And then making sure that we cover kind of the ballot outcomes and how these things work. So if you look at Chapter 7 of the attachment, it's quite a bit of changes in that section. I won't go over them all for that, but I think this flow seems to make more sense to me. Does anyone have questions about it or concerns about anything?
I agree. When I was reading it earlier, I thought,
It's much more clear.
It flows better.
yes, it's much more clear. So I really appreciate, I know this type of edits and reworking takes a lot of time and energy, but I think it's really much better. Be really, really helpful for future board members too.
I agree. Very clear. I do have a question on page 9.
Okay.
On number 8, just for clarification for myself. So when the result of the vote is announced and it passes, having this example, it says the ayes have it and the motion is adopted. I frequently hear the motion has passed. So does that also give this flexibility to use another term that shows that we can move forward with the motion?
Oh, it's
Okay.
just an example. Yeah, you definitely don't have to use that example. I don't use it, right? So I often say the motion passed or
EG means, for example.
Okay.
we aren't limited by it. It's not like a reg where if we put a couple examples or if we put too many examples, you have to use those.
Okay. Can we put the one that we most frequently use for the example instead of adopted?
Yeah.
Okay. And the motion passes. Because I haven't heard the adopted one since
Yeah.
I've been here. Okay.
Well, I'm usually the one announcing it, so it's whatever
Yes.
normally comes out of my mouth.
Yeah.
No, I don't say it in that way, yeah.
Okay, thank you. Motion passes. I think that's it. It looks nicely done.
Always happy to clean things up. If there aren't any other edits, we can adopt it as amended, or if you want to see another version, although that's a pretty technical one.
I have one more question under the strategic planning on page 15. The board should update the strategic plan periodically. What is our historical timing
We do 4 years.
for years? Like,
Usually somewhere around sunset. So like we just updated our strategic plan last year and then we go into sunset 2 years. So it's kind of a in between the sunset process.
okay, so 3 to 5 years, hence that. Okay.
We've been sticking with a 4-year plan. I don't know why. You could do a longer one if maybe the board at some point had a bigger, broader push for something. Maybe you would go to 5 years, but in general, 4 seems to be pretty good for boards. And it does right now fit nicely right in between sunset. So you go to sunset, 2 years later, you update your strategic plan, then you go to sunset 2 years from that. So
Would it be too prescriptive to say, for example, every 4 years?
Then you're locked in.
then you're locked in. If you ever found a need, you might even say we need to go to 3 years. Not that I plan to get there, but if your board starts running into difficulties, you could decide that. Or say you had another change in leadership and things were kind of rocky at the start, you might say, hey, you know what, we don't want to wait every 4 years. We want to do every 3.
Right.
So I don't imagine we'd move to 5. My guess is you'd only want to do that if you had maybe some big campaign that was longer. So you wanted to extend it by 1 more year because you want that big long-term campaign in there. But again, goals can go from one strategic plan to the next as well. So
Okay, yes. It opens it, it keeps it available
Yeah.
for that variance.
yeah.
Yeah, okay. That was my other question, to see if it would be too prescriptive to put exactly what we're doing. So yes. Okay, thank you.
I have a small non-substantive edit.
We
Which is,
appreciate it.
for example, on page 6, under vaguely key in Open Meetings Act, 1, 2, 3, 4, the 4th line down. Commas should go inside quote, not outside quotes. So 1, 2, 3, 4 lines down, so public scrutiny should be comma, quote, unquote. Like the comma shouldn't go outside.
Oh, thank you. I was like, I'm not seeing.
And I think that's throughout. There's another one on page 23. The last sentence of the paragraph there, complainant. And there's a few others. I think it's just throughout the document.
Good.
Oh, there's somewhere it's right. On page 8, it's all correct. So
So find the commas and put them
Find-
inside the quote.
Global
Change.
Yep.
Place.
Okay, thank you. At this time, hearing no further board discussion, I'd like to ask for a motion to approve the Administrative Procedure Manual as amended.
This is Dr. Sanders, and I move to approve the board's administrative procedure manual as amended.
Do we have a second? Okay, thank you. I'd like to ask the moderator to open public comment on WebEx at this time.
We are open for public comment on agenda item 10 and the motion. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen, and we will call on people in the order we have requests. We're going to take a few seconds now to see if we have a request for public comment. Seeing no request, you wish to check with the other locations?
Yes, please. I'd like to check in with Sacramento first.
This is Shelley Jones from Solid. I just wanted to, just as kind of as an FYI, let you know that if at any point in time you determined you wanted to say your plan expires next year, but you just came out of sunset and there's some things you want to get in your plan and start working on, you can always send a request to Solid to have your plan revisited earlier to add those items to sunset. So even though you have a four-year plan, you can always bring it up earlier if you like, just reach out to Solid and let them know you'd like to do it a year earlier. We've had that happen before with a board who actually finished all of their items early, so they requested to go renew it a year prior to what was scheduled. So that's an option for you.
Thank you.
Welcome.
Gold star for them, getting it done all the.
Doesn't happen very
I was
often.
gonna say, that would be nice.
I like I lost the. Can you hear us okay?
Yes.
Okay, I thought we lost you. Okay, at this time, I'd like to ask Ms. Burns to conduct the roll call vote.
Ms. Dominguez,
Aye.
Dr. White,
Aye.
Mr. Borges,
Aye.
Dr. Chambers,
Aye.
Dr. Sanders,
Aye.
and the motion passes.
All right. Moving on to agenda item 11, discussion and possible action regarding potential options for obtaining authority for and implementing a retired license status for board licensees. I'd like to ask Ms. Burns to present information on the retired license status at this time.
All right, thank you. So for at least the entire time I've been at this board and at my prior board, board licensees have often requested to place their license into a retired status instead of having what currently goes on, which is that you don't renew your license as active or inactive, you just let it expire. And then once it's expired for 5 years, it cancels. Or if you're on the hearing aid side, 3 years and then it cancels. So, but of course, you can't just create your own statuses and the like. So during the continuing professional development audits, the board licensee staff have come across a handful of people that have professionally retired and that they should have been in an active status, but for some reason, one or another, they were not renewing inactive. They just kept renewing active, even though they're retired. And so we've had those issues. On top of getting the continuous requests when people call and ask and say, oh, I've retired, can I retire my license? And we're like, no, sorry, we don't have that opportunity yet. So right now, sunset is a good opportunity to have the discussion. So we've gone ahead and provided the information. There's kind of two routes to go with this. So in looking at the retired license status back in 2017, the legislature authorized any board within the Department of Consumer Affairs to establish through the regulatory process a retired license as shown in Business and Professions Code Section 464. So what you'll see here is that you'd establish it by regulation, and the regulation can contain the following items. A retired license shall be issued to a person with either an active license or an inactive license that was not placed on inactive status for disciplinary reasons. The holder of the license cannot engage in the activity for which the license is required, so you can't practice unless the board specifically has criteria for that. Some do. And then the holder of the license, retired license, shall not be required to renew. So you essentially go into retired status and then you stop renewing. The board would establish an application fee through the regulatory process. So we would estimate the cost and then say that fee in the regulation. And then in order for them to restore or reactivate that license, the retired license holder would just pay the fee, certify that they haven't committed any crimes, make sure there's still fingerprint requirement is still met. Most often when your license cancels, we put in a no longer interested request with the Department of Justice that says we no longer need subsequent arrest information for this person. They're no longer an active licensee, right? When you cancel, you fall off our list, right? And then you'd also, update your CE and turn that into the board. And then any other requirements as specified by the board by regulation. Of course, you still can take action against, if you say you retire and then we get a complaint, we would still have jurisdiction over you because you're retired. When you cancel, we no longer have jurisdiction. When you're no longer our licensee, you're canceled, that you're no longer our jurisdiction, right? You then become, if there's something going on and a problem at that point, unlicensed practice. So it's a little different. And then subdivisions A and B don't apply if the board has their own statutory authority to create this retired license status. So interestingly, my last board actually sought through their sunset and got in 2016 or 2015. Anyways, right around that time, they'd gotten their statutory authority separately. And I think the legislature was kind of like, hey, you guys keep coming to the well. Let's just give you all the authority to do it by regulations. So that's one way that the board can do it. But we have some concerns, right? So there's three technically. So the first concern is that it authorizes any individual with a license in active or inactive status that wasn't placed there by disciplinary reasons. Technically, that doesn't bar those that are currently on a restricted or probationary license from going into retired status. It also doesn't allow that if you have not abated and paid your citation and fines to also go into retired, which only becomes a thing of if you're not renewing, you no longer have a backstop where the board says, hey, you have to pay your citation and fine. It's not often, but it can happen. And then licensees that are currently under investigation, those that have an active complaint that's being investigated also could be applying to be retired status. So there is a little bit of a concern that this one just says if you're active or inactive, go ahead and apply. It doesn't really give you can't apply, you can only apply if you're in good standing with the board at that moment. Some of the other boards have statutes that talk about a license in good standing. They talk about there are no restrictions on the license, unrestricted and active. There's a couple varieties, but they're not the plain active and inactive that the general statute has. So that's the first consideration.
Before you go on to the other question, so what you're saying is if they go into retired, they basically fall out of the system, so you're not no longer tracking them?
They don't.
They have, I said, well, first of all, I understand how being on probation isn't a disciplinary reason, but.
Well, you're not placed on an active status.
Okay.
Yeah, you're still active, but you have.
So if they've got all these things that are happening and then they go on to retired, you're not then able to continue to go.
You
After them
can
and track them.
continue to go after them and track them, but if they're on probation, they would enter hold status. But
Okay,
they're not actively practicing.
right.
So normally you want to offer a retired license to those that are in good standing.
Okay.
And this doesn't have that prohibition of not allowing those in good standing.
Okay.
Some boards have an interesting version of the wording where it's, they let active and inactive, but their statute says, but the board may deny you for blah, 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 blah. As where I would just say, why not tell them you can't, like
Right.
you can't apply unless you're in good standing, which means you don't have an active investigation against you. You're not already on discipline or we're not still waiting for you to pay your citations and fines.
Okay.
So,
Okay, thank you.
yeah. It was interesting to me because back not that long ago, I didn't know we had a general one, to be perfectly honest. I remember all of us boards going for the your own statutory thing, not knowing there's a general one. The second concern is that it would authorize any individual with a license in a retired status to reinstate that license regardless of the amount of time that they're in that retired status. So this is potentially allowing those that have been out of the practice and not maintaining their continuing professional development for many years. If you retired early and then you say you came back a decade later, there's no restriction. You're no longer as up to date on the practice as you would be had you been keeping up your continuing professional development, right? So that lack of a prohibition on how long you can be away from the practice before coming back without taking additional steps is a little concerning. And that's just the way it's written, right? So right now, if you're, say your license right now is up to, what is it, after 5 years? Yeah, so if you've been an expired for 5 years as an audiologist or speech language pathologist, or 3 years as a hearing aid dispenser, you have to reapply.
When you say expired, you mean on inactive status?
Their active license went to expired and they failed to renew.
Because they just never.
They just
renewed it.
never
They
renewed.
didn't go on any status, they just stopped.
Whether that was
Right.
oopsie or whether they thought, oh, I'm retiring, so I'm not gonna do it. Right now, you only have 5 years or 3 on the hearing aid side, right? So, and most boards have that provision, right? We don't want you to be just out of the practice for a specified number of years and coming back as if nothing happened. Because the practice changes, it evolves, right? And you need to continue maintaining that confidence. And so I provided those sections for both of you guys. And then the third concern is there's no cap on the number of times you can hop in and out of the retired license status. So I know this may or may not be a concern for most, but right now, if you went into retired, it's a one-time payment and then you don't renew every 2 years or every year, right? So this is a interesting way if you wanted to, because of course my systems don't have any way to stop you. So if you can just hop in and out, you could be technically using it as a way to be free on inactive, and that's a problem. So some other boards have said, you can hop in and out a certain number of times. I get it. You thought you were retiring and a couple years later, that 401k is not working out the way you thought it did. And so you want to start practicing again, or some opportunity of a lifetime, came along and, I really just want to take advantage of it and I'm going to work another 4 years or whatever.
And you just also say you've got to pay the, every year's worth of renewals that you were out.
If you're going to use that statute, the general one, you kind of have to follow along that. You
I'm
can,
just saying as an alternative.
there's those
Since it
opportunities.
clearly seems we're leaning towards not using the general one.
Up to you guys.
I'm just curious, that's something that would be
There's that
technically
option.
allowable if we wanted to do that.
And we could have a statute that says it that way. The other one being, we could also say, you can only hop in and out 3 times
Right.
before we're not going to approve any retired status. It's too many.
I was gonna say that's too many.
So these are the things we have to think about, do we want to use, if the board wants to pursue this, which I would presume you might, there's use the general and use the regs. There's also instead, let's see if we can possibly include it in our sunset as a way to get it in there with our own current provisions so that we don't have to use the general one.
What are the reasons usually that people are seeking to have a retired status rather than expired? I'm guessing, or inactive. I'm guessing it maybe has to do with like memberships. If you want to maintain your membership to ASHA or AAA, is there a retired? I think there's a retired category, and so I'm wondering if for that category you have to show that you're
I don't
licensed
actually
for
know.
retired. Or?
Normally on the phone, it's really more of the fact that I worked really hard and I had this long, wonderful career, and I don't want to be seen as delinquent or expired for 5 years. And then when people look you up, you just cancel. which also, I don't think people like that. Like,
That's what inactive means, is you're canceled.
No, there's active, there's inactive, and then there's canceled.
Well, see, so that's what I'm trying to understand, like, why do we need to create a retired category if the inactive category is already there?
Inactive, you pay the same fee as the active fee, so you're paying that every 2 years.
Okay.
So it's
Or
up to
every
you.
year.
Yeah, or every year. So up to you guys, but this gives you an avenue where I can be, I always call it a graceful exit, right? There's an exit strategy. I can have my license. It doesn't look like negative, canceled or delinquent or expired. But it says retired and I no longer have to pay every 2 years.
Yeah.
Or 1 year.
I mean, I think it's okay to create the category. I can see why people would want it. Obviously, it's not just a thing for our board to be addressing. If other boards have addressed it as well and created those categories, so I would support doing that. To answer some of the questions that were posed, in my opinion, we should definitely require that they be in good standing in order to retire. So because they could just continue to pay until that's resolved, and then if they want to retire it, they could retire it at that time, right? Once the action's resolved. So I would highly suggest we do that. I think allowing them to come out of retired status once and to take it a second time, which I think is reasonable. I agree. You could say, I'm going to retire my license because now I'm a young mom and I'm going to stay home with my kids. And then, after 6 years, okay, I'm going to practice again. Oh, now I have another kid and I'm going to retire again. I don't know, like for all sorts of reasons, to allow someone to hop in and out and not have to pay the fees and maintain the licenses. Sketch, I think. I don't think we want to get into that. And then I don't know what you guys think, but I like that 5-year time frame that you were mentioning already. In terms of you would have to totally reapply, because it is concerning. What if you have someone that's retired and 10 years later they want to pick it up again? And 10 years is a long time for the practice to have changed. Do we require that they complete a year's worth of CE before they come out of retirement? Do we just say, well, you did it for 40 years, so you're probably good? I mean, I wouldn't recommend that. So I think that's definitely something we should figure out.
And that's, hearing aid technology is dramatically different 5 years later.
Mhm.
So I was thinking more like 3, just from our standpoint, because it can be very, very different in that amount of time. And yeah, the question, okay, how many CEs is appropriate? So if we only have to do 1 year's worth, and I've been gone for 3 years, and maybe it's unreasonable to say you got to do 36 or you got to do 60 or whatever. But, there's a lot of, change that's gone on in a 5-year time frame for just 1 year's worth of CE used. So I think we should debate that a little bit between the 3 and the 5, at least from a dispenser standpoint. I have a question too on the holder of the license. It was the section 464.2, where it says the holder of a retired license issued pursuant to this section shall not engage in any activity for which a license is required. Does that also include being an examiner?
Yeah.
Mhm.
So they could not be an examiner if they had a retired license. Okay, I wanted to be clear on that because I could see that as, and I know how hard it is, you guys try to find examiners, but I don't think someone who's retired should be an examiner testing people for their license. So I wanted to be pretty clear on that point. And I have this note, I think this might have been speaking to what you were saying, but I had another one that I wrote. Something about making the retiree license the same standard as the inactive, but I don't know. I'm not sure what I was talking about. Now that I look at it, that's what I get for making short notes.
I mean, if we talk it through, okay, so I retire my license. I go into retired status. It's been a decade. I want to come back. My life has changed for whatever reason, and I need to go back to work. Is it reasonable to just say, well, it's been 10 years, you need to redo the entire
Yeah,
application?
let's start from scratch, absolutely.
which would mean retaking the exam.
Essentially, yeah.
Yeah. It would mean possibly having to retake the praxis. I mean, for
Unless you meet one of the exemptions.
uh-huh.
And I would say I'm just gonna be perfectly honest. This person said she's been retired for years, but she keeps up her CEUs. Ash's version, so no lies. So they could be keeping up some amount of CPT all those years, or maybe even trying to keep up their triple Cs or their national certifications. They might come back. But that's kind of the question mark. Not all of them are doing that. Some are just, I've not been practicing. Interestingly, some have toyed with coming back, but even they said, I would have to take more than just the CEUs for one renewal cycle to get myself back up to speed to practice. So at least some of them are really cognizant of that as well. But right now they don't have a retired. So as we've been doing the audits, it's why weren't you renewing inactive? Oh, I didn't know that was an option. Okay, so like that's your option. If you think you might come back and you're just going to be keeping up your requirements anyways, you can be inactive. We're not going to audit you for that. You just continue to be inactive, but there is the fee, so you're paying every 2 years. So nominal again, we're not talking a ton here. On the other side, obviously. So that's kind of the interesting part.
And is that basically what's driving this, is the fees? By being retired, I don't necessarily have to pay the fees versus an active. I have to pay the fees every year.
I think
is that one of the main
that's one of the
driving
reasons.
points?
But there's also just there's many of them that
Perception.
the perception.
Right, that I'm not, I quit.
Yeah.
Yeah.
And who wants to be canceled?
Right.
But I'm actually retired. And I get it. Like, that's a lot of life's work. And on the staff side, I'm going to tell you just data wise, and I know this isn't a big concern for everybody, but it makes it a little harder for us to estimate our population, right? So I have a lot of people in an expired, soon to be canceled status. Are they, oopsie, I forgot to renew, which can happen, or are they, hey, I'm actually retired and I really should be off your rolls of people I need to be concerned about, right? For us right now, it's all a big mismatch, right? We know if you renewed inactive, you intentionally said, hey, I'm not practicing, I'm inactive, right? But then we have all these people that are renewing active because the only way you can renew online is active, and they don't think about it. And then on the other end, of course, expired, right? They're just sitting there expired. Are you potentially actively practicing, or are you actually retired and I should just not be worried about you as a population piece? I mean, you're still there and you're in my jurisdiction if you're retired, but I'm no longer thinking, hey, you might come back to practice.
Yeah, it's almost like there's kind of two things to it, which is from the consumer protection standpoint, having someone come back out of retired status that's been in it for more than X number of years, 3 years, 5 years, 10 years, isn't probably, it should be difficult. It should be difficult. You should have to prove that you know what you're doing again. Like the fact that you would have to go back through the entire process isn't, in my mind, isn't unreasonable from the consumer protection side. And if we make it difficult to come back from, then hopefully it will be used for really the purpose for which it's supposed to be, which is if you may come back, you should be in inactive status and maintaining your stuff, and not use retired. And retired really should be, I'm done as far as I know, and it should be a one-off that like you're ever trying to come back from it, and not a frequent thing. So I think what we don't want to do is make it so easy or reasonable to come back from that they're then using that in place of inactive, but keeping it and paying my fees. And
Gilda, you, Dr. Chambers, do you guys have any thoughts or issues about this?
Yeah, absolutely. So I was going through the discussion questions as Dr. White has started to address. I agree that for question 1, that they shouldn't be allowed to place their license on retired status if they have a current administration or administrative enforcement action or disciplinary action against them at that time. If there's any type of situation that needs to be mitigated first. And then I also agree that we do need to limit that capability of going into retirement status and then going off and then coming back. I think once. I don't think they should be able to do that more than one time. Yes, maybe they're in the retirement situation, like you said, Sharice, that, maybe their 402B or 401K, didn't, or 402B or whatever it is, didn't work out, that, okay, I need to make a different life decision and I need to work again. So I think one time is something to be considered. And then 3 years, 5 years, again, technology changes, scope of practice changes. There are competencies that need to be completed for certain tasks. So again, definitely not going over 5 years, but I would propose something like 3 years, and making sure that they have completed CEs for the equivalent of how much is required per year for that profession. It's quite feasible to be able to get 12 units in 2 courses, especially if they're 6-hour courses. So you can get 12 hours in a week, and I don't think it's impossible to make up multiple years of CEs in a shorter period of time, so you can reactivate or come back to active on your license. I do think all the required hours of education should be completed, equating to the length of time that you have or that person has not been practicing. So if they're gone for 2 years, for example, for speech, they should do 24 hours of CE before they're able to come back. And I think it's feasible. I think it's doable. Those are my thoughts.
Concerning the CEUs, I'm torn on that, because for dispensers, they're hour-long courses, and you'd have to come up with 3 years, you'd have to come up with 36 different courses.
Mm.
And then the question of live versus recorded too. Because at least for the dispensers, it's 6 units live and 6, or it has to be live. So then are we gonna hold that same standard as well, live versus recorded? Because then you're talking about, 12, possibly 18 live units. And those are easier to come by now that the rules have changed. But that's still, that's all, that could be a lot. So, I mean, I think that's just something we need to, we also need to kind of talk about too, does it have to be live versus recorded? Because that kind of changed the calculus a little bit as well.
Well, I also think if we're talking about in terms of, hey, there's my golden opportunity I can't pass up, or, oh gosh, I'm in a financial situation, I need to go back and get a job. If we're talking about trying to take 36 classes.
Right, to get the job.
And now I can't get this job that was made available or that I want to apply for and I'm in a situation where I'm kind of, it's urgent. So I imagine it would kind of have to be to want to come out of retirement. You don't want to make it so cumbersome that then they cannot,
Right.
apply for or get that job unless there's like an on-ramping period where it's like, okay, well, within the first X number of months of practicing, you need to make up all those CE or, or if we're.
No, you can start before you do the application, and
Right.
say 6 months prior.
Yeah.
Applying, you can start taking classes if you have an idea, because you're right. If someone offers me a job and it's gonna take me 3 months to get my classes, then
Right.
I'm gonna get that job.
And I think I have a little less of a concern if we're really talking about limiting it to 3 years. That's not a long time to be out of practice. For most people that are retiring that have been doing the job for likely decades, that's a lot lower risk it's a lot lower risk if we're talking about someone can only take advantage of this after 3 years as opposed to 5 or 10. That would be a different story. So I'm not sure if I agree that like they have to get all of those CE redone for that entire 3 years as opposed to some smaller number, just because of the period of time being short.
Right, yeah, I mean, and from a hearing aid standpoint, 3 years, hearing aid technology's changed once, and that's basically a year's worth of CEUs to kind of catch up
No, I
in
mean,
that regard, so.
Yeah.
Coming back into it, a lot of it is gonna be that emergency. So you are retired, you're relying on the one spouse's income, your spouse dies.
Mhm.
I need to go back to work now.
Mhm.
And so having a delay of 3 to 4 months is not, that's not the reason I'm doing this. The reason I'm doing this is it's an emergency. I need to do it. I'm desperate.
So I mean, I agree, Linda, or Gilda, sorry. I think that limiting it to maybe like one time, because it shouldn't be a repeated thing.
Right.
And if we're limiting it to that, and we're limiting it to, well, it has to be within 3 years if that's what we decide. I think just doing the current year of CE.
Yeah, whatever that 1 year of CEs is.
That's doable in a.
Yeah.
Mhm.
Well,
So
yeah.
not
in a
one
short
renewal
time
cycle,
period.
1 year's worth.
Good
So
question.
it's different for both
You're right.
practices.
Yeah.
So
Right. Yeah, that's.
For you guys, I know
that
you're
turn of
saying
phrase
1
is very
year.
different.
Yeah.
Because I'm saying 1 year because we renew every year.
Annual.
yeah, so regulations that we adopted, that were adopted last year and this year, requires that if the licensee let their license expire to complete their continuing education for the most recent renewal period is how we have it.
Renewal.
So
So for
whatever.
speech,
So it'd be the 1 and the 2, yeah,
Gotcha.
What speech?
24 hours,
Let's say.
Yeah.
over 2 years.
2 years, yeah.
And non-dispensing audiologists, right?
Correct, yeah.
That's why I was saying.
I think that's the cleanest to say renewal period, because then it's applicable to each.
Right, that's what I was alluding to. If it's 2 years, 24 hours, you can do that in 4 classes.
Does it look
least for speech.
differently for the recorded versus live? Is there, like the person you said, like their spouse dies, they need to get immediately to work? Do we feel differently about it if it's recorded versus a live option?
I think there are a lot of live, like audiology online. Again, I can't speak for speech, but for audiology, I think there are quite a few live options weekly available on those sites. It's not live like you have to fly somewhere or go to a conference. It's hopping online and finding a live course.
It is better for hearing aid dispensing. Audiology's probably got 3 times as many at any given time if you look like say Audiology online. And it is better for dispensers. But here's the problem. So let's say there's 6 courses of live online that you can take. That's your 6 units. The problem, those 6 courses are spread out over the next 4 months. So I signed up for a course that's live, but it's May now and it doesn't happen until July or October. So you're not going to get 6 courses live in a short time frame. So I think that particular requirement is not feasible.
So what if you turn those into recorded options instead? Or some percentage, at least half of them have to be live, or some percentage wise, or something that can be recorded as well.
Well, that's what it is now, 50% live, 50% recorded. But that's the problem because those 6 units that have to be live, that's gonna be 6 different classes, not one class. And each one of those classes, like right now, I go in January and I'm signing up for courses all the way through the summer just to get my 6 live units. Because that's all that's available. Now, if I'm lucky and there happens to be like HP or someone has a conference, just happens to have a conference that month, I can spend $1,000 and go there and get them all. But that's you're really threading a needle there at that point. So
More limited on the hearing aid
Yeah.
dispensing side than it is on the speech or audiology
yeah,
side.
it's trying to get those live in a short, if we're talking about needing to do it because I need to go now, I don't think that that's gonna work. We can say it, but then we're basically, we're eliminating that possibility. So, I think in this case, it would have to be, you just gotta get the units.
Yeah,
As
Either
long
way.
as long as they are approved by the state of California, that's gonna count.
I agree. I concur, especially with the hearing aid dispenser. That sounds more challenging.
Mhm.
Be very-
As for speech, I mean, we have many different platforms that we can quickly, if need be, get live and recorded course offerings.
I would suggest if we're talking about suspending the synchronous versus asynchronous, live versus recorded for the retirees, that we just do it across the board
Right.
rather than trying to.
Yeah, I don't think you pick one out,
Right.
and separate it from the others.
Yeah.
I think
That's true.
the universal,
I agree.
fair thing.
Yeah. Yeah, I didn't realize it was that much of a challenge for the hearing aid dispensers. Thank you for shedding light on that.
That's why I was pushing to allow manufacturer courses be included in the CEUs, because it's tough.
Yeah.
You're lucky to find your 6 in a year. Boy.
Jeez. Wow.
Mm.
Oh.
So then would we say that across the board, it would be okay for recorded lectures to count towards those units?
It sounds like we'd be wanting to say that you would just need to meet the number of CEUs and not say that you meet the the CE required for renewal. You would just specify the number of hours.
Not necessarily have to worry about specifying exactly can be this or that, just say you gotta do this.
So we'll have to look at maybe some wording, because this would definitely be different than other boards, what they're implementing, because they're usually using their regular requirements to reinstate. So we can definitely work on crafting some language for that.
And then we would want to make it clear that if they were continuing, obviously, that next renewal period, that they would be back to having to meet the requirements that everyone else did.
If you don't specify asynchronous or synchronous, then how many phone calls do you think you're gonna get when they then ask you, does it have to all be recorded or can it be live? So it would make sense to include it just for clarity's sake, because otherwise you're gonna get 50 phone calls asking that, so, yeah. I'm trying to save some a little work.
So I just wanted to clarify, so we're not just asking them to do 1 year worth, right? Well,
I think we are.
speech for audio, speech.
For
and
one
audio.
renewal.
It's the renewal, so
Renewal cycle, whatever that renewal cycle is for that license.
if they need 24 hours, then that's what they're getting.
Yep.
Okay, that's what I was trying to communicate earlier, that I feel like they need to show that they have maintained those CEs for that duration, a longer duration of time, right? So renewal cycle makes sense. I know I mentioned 3 years, but really the 2 years is for speech and audiology, and then for the dispensers, you said that's 1 year, right?
Correct.
Yeah, so I think they should keep it up, whichever way they can. So is that synchronous or asynchronous?
Mhm.
Correct.
Mhm.
And only be able to do it once,
Yep, I think we're all pretty.
and not be able to retire, go into retired status if they're under investigation.
Mhm.
Right, good,
Sure.
in good standing,
I think we got it. Okay.
We'll look at some of the language.
right,
This will
Got
definitely be unique to our board, so.
yeah.
Okay.
I don't understand that at all.
So do we have to have a motion to ask the board staff to look into that further, or are we?
Could just delegate staff to do it,
So
I
you
think,
do it.
yeah.
Do
We will work on that and bring it back to you.
Did you say motion, correct, or no?
No motion needed.
Okay,
Legal
all right.
counsel's advice.
okay, thank you. All right, any other board discussion?
Good.
Okay, I'd like to ask the moderator to open public comment on WebEx at this time.
We are now open for public comment on agenda item 11. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen, and we will call on people in the order we have requests. We're going to take a few seconds to see if we have a request for public comment. Seeing no requests, you wish to check on the other locations?
Yes, we'll check on the Sacramento location.
There are no members of the public at the Sacramento location.
Thank you. And at the Glendora location, there are no members of the public present. Okay, we'll move to agenda item 12, regulatory report, update, review, and possible action on board regulation packages. I'd like to ask Ms. Lorenzo to provide the regulatory report.
Thank you, Ms. Dominguez. The first item on the report is CPD requirements for SLPs and audiologists. This regulatory proposal was approved and filed with the Secretary of State by Office of Administrative Law on September 6, 2024, and became active on July 1st, 2025. For more information, visit the board website. The link is provided for the direct location of that rulemaking. This regulatory change clarifies definition to reflect advancements made to SLP and audiology CPD courses delivered online, increase the number of self-study hours to half of the total required hours, removes limitation to the number of hours that can be obtained from courses that are related to the practice of SLP and audiology, increase the number of hours that can be obtained from indirect patient-client care to 25%. The total required hours, permit other opportunities to fulfill CPD requirements, and clarifies current regulations by making CPD requirements consistent with the board CPD process and professional learning requirements for similar license type and course contact. The next item is advertising for HAD. This regulatory proposal was approved and filed with the Secretary of State by Office of Administrative Law on December 30th, 2024. And became effective on April 1st, 2025. For more information, visit the board website. The memo has a link to the that directly take you to the rulemaking. This regulatory change clarifies that anyone licensed to dispense hearing aids can advertise fitting and selling of hearing aids in accordance with Business and Profession Code Section 651 and CCR Section 1399.127. Information required advertisements, prohibited advertisements, and national advertisement disseminated in California. Item C is processing times. This regulatory proposal is in the finalizing regulatory package phase and requires review and approval by the board. We do have a memo and materials for that discussion. This proposed regulatory change will remove processing time and references to processing times in multiple regulation sections. Next item is D, audiology licensing requirements related to supervised clinical experience. The board approved revisions to the proposed regulatory text on December 6, 2024. The required regulatory documents completed the departmental review process on April 22nd, 2025, and was noticed on May 2nd, 2025 for public comment. The 45-day public comment period will end on Tuesday, June 17, 2025. This proposed regulatory change will codify the number of clock hours of supervised clinical practice required for audiology licensure applicants who have completed an audiology doctoral program. Item E is HAD trainee and temporary licensee supervision. The board approved revisions to the proposed regulatory text on August 25th, 2023. As of May 1, 2024, board staff is preparing the regulatory package for departmental review. The rulemaking is on hold for preparation and submission of other pressing regulations. This proposed regulatory change will clarify that supervision is required for the entire duration of the trainee or temporary license, specify different levels of supervision, require a higher level of supervision during the first 90 days of supervision, specify task and knowledge supervisors must provide to trainees, require supervisors to complete a training in supervision, specify criteria to request a waiver to supervise more than one trainee or temporary license holder, make requirements applicable to all license types who require supervision, and make requirements applicable to all license types who can supervise. Item F is the general application requirements and HAD and dispensing audiologist exam requirements. The board approved revisions to proposed text on December 1st, 2023. As of April 19th, 2024, board staff is preparing the regulatory package for departmental review. The proposed rulemaking is on hold for the preparation and submission of other pressing regulations. This proposed regulatory change will codify general application requirements such as the expedited licensure process, make current the written and practical examinations process, codify the written and practical examination application forms and their fees, change the practical examination appeal deadline, specify a deadline for the board to notify an applicant of its decision on their practical exam appeal, and change the hearing aid dispenser examination requirements for applicants of a dispensing audiology license. Item G is approve institution. The board approved revisions to the proposed regulatory text on August 25th, 2023. As of August 13, 2024, board staff is preparing the regulatory package for departmental review. This proposed rulemaking is on hold for further analysis. This proposed regulatory change will permit the board to review and approve accrediting bodies that wish to provide accreditation to programs where individuals can complete their academic and clinical requirements for licensure in the practices of SLP and audiology. Item F is fingerprinting requirements. The board approved revisions to proposed regulatory text on May 13th, 2022. As of September 9th, 2022, board staff is preparing the regulatory package for departmental review. The rulemaking is on hold due to fiscal impact. This proposed regulatory change will require licensees who were initially licensed prior to January 1, 1999, or for whom an electronic fingerprint does not exist to be fingerprinted as a condition of renewal. And that completes my report.
All right, thank you. Thank you for your presentation of that. I'd like to open up board discussion at this time regarding the regulatory report. Okay, hearing none, I'd like to ask the moderator to open public comment on WebEx.
We are open for public comment on the regulatory report. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen, and we will call on people in the order we have requests. We're going to take a few seconds to see if we have a request for public comment. Seeing no requests, do you wish to check in with the other locations?
Yes, thank you. I'd like to check in with the Sacramento location.
There are no members of the public at the Sacramento location.
All right, thank you. And there are no members of the public present at the Glendora location. I'd like to now ask Ms. Lorenzo to provide the report for 12C at this time.
Thank you, Ms. Dominguez. These are regulations repealing processing times. The proposed regulatory change will remove processing time and any references to processing times in multiple regulation sections. Board staff noticed the proposed rulemaking with a 40-day comment period from March 14th, 2025 through April 29, 2025. The board received one comment with objection or recommendations during the comment period. There were no requests for the hearing or no separate public hearing was held. Again, the board is required to review and respond to written comments. Or the board is not required to review and respond to written comments and support, but they are required to review and respond to written comments that object or make recommendations in accordance to the Administrative Procedure Act. So board staff has drafted a board response to a comment we received. And the comment, the actual comment can be found in attachment A.
Sorry, we lost connection. I don't know if we're the only ones, but can you, we didn't hear most of that.
Okay, like at all? All right.
No.
This proposed regulations will change processing time and any references to processing time in multiple regulation sections. Board staff noticed the proposed rulemaking with a 40-day comment period from March 14th, 2025 through April 29, 2025. The board received one comment with objection or recommendation during the comment period. There were no requests for public hearing and no separate public hearing was held. The board is not required to review and respond to written comments in support, but it is required to review and respond to written comments that object or make recommendations in accordance to the Administrative Procedure Act. Board staff have drafted a proposed response for board review and discussion. The actual comment can be found in attachment A, and we have an order of adoption language and suggests a motion to continue with the rulemaking process.
Can I ask a question?
I'd like to open it up for board comment at this time, to board discussion.
So why was the time frame in there in the first place? Is it something that the board voluntarily added and then, but we were never actually held to it? Or is it that something's changed and that now you no longer have to be held to a specific period of time?
There used to be a law that required all the boards
In the
to have,
government code.
yeah,
And it was repealed.
And it was repealed.
Okay.
But technically, we couldn't do a section 100 simple regulatory change because
The authority had our Practice Act and not that government
that
code.
section. So we couldn't just simply, oh, you struck it, we'll strike it from ours. We had to actually do a package. So
And what was when we weren't meeting the goal, what happened as a result of that? Law being
people complain, but it's really, you set a goal. Our old ones though, if you remember, they're kind of awkward, right? So what was it? Where's that part? You have so many days to say that you got the application
Right.
and is it complete? And then you have so many days to issue it.
189 or
It
something.
was a whole bunch
Yeah,
of like,
17 days for
Yeah.
hearing aid dispensers.
Mhm.
and then 189 days after that.
I guess what I'm asking is, even though the law that was in place at a time, it didn't actually impact anything because we can only do what we can do in terms of workload. We can only process what we can process. And so it had no bearing anyway on the.
There was
board's
never a
function.
penalty, no.
So it didn't
Yeah.
matter.
It was always a goal. And we've had the goal with DCA for our licensing performance measures at 30 days for much longer. And we now successfully hit that all the time,
Mhm.
which is great. But it has been the 30 days goal with DCA.
Well, and there are so many, when you're in a large system, there are so many things outside of your control that impact your ability to process work and do work. So it's not really a substantive change because there was no teeth in the first place.
There was no teeth in the first place, and it was an old law that required the regulations. So yeah.
Got it.
And I do want to know in the initial statement of reasons, I did specify that we are required to report processing times on a, I think quarterly basis, but the board does it on a weekly basis. So it's not like we're just getting rid of the information. It's just,
We actually exceed what's required by law in providing information.
correct.
We do try to do it weekly. Sometimes it's bi-weekly. Either way, it's more than quarterly, which is what that law a couple years ago or now required. So, I mean, the goal here is to just be more transparent and yeah, we don't need an artificial other requirement. We already have the goal. Thankfully, we meet it.
So the only law pertaining to processing times now that you have to do is make sure you're updating it quarterly,
Yes.
which we obviously do more often. And that's it.
And not all boards have done it. So when that law came into effect, there were plenty of boards that didn't put their processing times on their website. The DCA data portal has had our licensing processing measures in arrears for quite some time. It's a quarterly report that gets sent over there and it gets put into there, but you'd have to weave your way over to there. So, I think it was in 2020 when I got here, I said, let's start putting it on. Let's start updating it more frequently. Since we're already getting them in-house, we might as well be putting them on the website so that people can see, here's where we're at.
Right.
Because hopefully it helps reduce calls. Back then, we were doing a lot of overtime and just barely getting 6 to 8 weeks during peak season. And, you know, we would call, well, did you get my application? And then another phone call, oh, well, are you at my application? No, we're at 6 to 8 weeks and you submitted it last week. So, I mean, it's kind of cycles, right? But of course now it's, hey, if it's been more than 2 weeks, you should be checking in and check your spam.
Right.
There's probably something wrong.
I mean, I understand the concern of the person who
Yeah.
commented, because, you know, if the perception is that the board was held to a particular time frame standard and now we're just like, oh, forget it, we don't need to do anything. We don't care what our time frame is, we don't need to do that. You know, perceptually.
The perception, yeah.
Correct, I could see where the comment comes from, but the truth is, it didn't matter
No.
anyway.
The law just used to require we establish the goal.
Got it.
So do we want to do, do we want to move?
Oh, I'm sorry. Any additional board discussion? I believe we have to ask for a motion and a second on this.
It's a long motion.
I got it.
Okay,
I'll
okay.
do it.
So there is suggested motion language on page
Yeah.
2. Someone likes to make a motion?
I move to accept the proposed board responses to the comments on proposed regulatory text 16 CCR sections 1399.113, 1399.141, 1399.151.1, 1399.153.2, 1399.160.6, 1399.170.4, and 1399.170.13, and direct board staff to provide the response to comments as indicated in the board memo on pages 1 and 2. Direct board staff to take all necessary steps to complete the rulemaking process, including the filing of the final rulemaking package with the Office of Administrative Law, authorize the executive officer to make any non-substantive changes to the proposed regulations before completing the rulemaking process, and adopt the proposed regulations at CCR sections 1399.113, 1399.141, 1399.151.1, 1399.153.2, 1399.160.6, 1399.170.4, and 1399.170.13 as noticed.
May we have a second?
Second.
Thank you. I'd like to ask the moderator to open public comment at this time on WebEx.
We are open for public comment on 12C and the motion. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen, and we will call on people in the order we have requests. We're going to take a few seconds now to see if we have a request for public comment. Seeing no requests, do you wish to check in with the other locations?
Yes, please, thank you. I'd like to check in with the Sacramento location.
There are no members of the public at the Sacramento location.
Thank you. And there are no members of the public here at the Glendora location. So I'd like to ask Ms. Burns to conduct the roll call vote.
Ms. Dominguez,
Aye.
Dr. White,
Aye.
Mr. Borges,
Aye.
Dr. Chambers,
Aye.
Dr. Sanders,
Aye.
and the motion passes.
Thank you. Moving along to agenda item 13 regarding future agenda items. I'd like to ask the board members and staff if there are any future agenda items that they would like to have or propose for a future meeting.
I have a question concerning that. When John Denneran was here briefly, he had 3 or 4 items that he had brought up that was given to him. One of them had to do with the supervision requirements after they failed the test, and a couple other things. Where are we with
They're going to be on the August agenda.
August agenda? Okay, thank you.
And then the other items that already came up as a result of the practice committees are already
For the items that were not on the agenda or the items that were part of the,
Well, for instance, the dome, are we gonna be discussing that and at the full, what we talked about at the committee meeting yesterday, will we be talking about that at the?
Does it say you
in
guys-
August?
did you approve, they didn't approve language, the
Yeah,
clean
I
language.
sent out, I've heard it.
So you'll get clean language at the next meeting and then
Okay.
the board would talk about it at the meeting after that.
And so the next future agenda, just need to make
Maybe
sure we
more
have
that.
the item about, not sunrising the audiology assistants on there for the full board. And up to Gilda, if, the other requests that came out of the audiology practice committee meeting should be discussed at the board or kept at the audiology practice, agendized for audiology practice committee. The one about dual licensure status update, on the testing for audiologists. What's the other thing, Dr. Wenzelberg?
I think we can.
Say when Maria makes the meeting minutes.
Yes.
Yeah, I always know, items that.
Yep.
That helps.
One thing on the dispensers, though, I know on the second item where we need the further clarification on maintain, but I didn't think for the dome removal, I didn't think we'd actually change anything. We discussed possibly changing the requirements for how you can get trained, but ultimately we left it the same. So I don't recall there being, I think ultimately we basically accepted it as it was.
I believe that's correct.
But did you take a
No.
motion?
Yeah, we didn't take a motion. We are adding odo block to the list of foreign object.
The ear dam.
Earlobes or.
And taking off earlobe,
Yeah,
right?
taken off earlobe. So you'll get the clean copy at the next meeting and then you go from there.
Okay.
Perfect. And then as we prep for the next board meeting, Sharice, we confirm what agenda items are on there.
Absolutely. And as the chair, you can determine whether things need to be at the committee level still or at the board meeting.
Okay. All right, thank you. At this time, I'd like to ask the moderator to open public comment on WebEx.
We are open for public comment on agenda item 13. If you'd like to suggest a future agenda item, please raise a hand by tapping that hand button at the bottom of the screen, and we will call on people in the order we have requests. We're going to take a few seconds now to see if we have a request for public comment. Seeing no requests, you wish to check with the other locations?
Yes, thank you. I'd like to check with the Sacramento location.
There are no members of the public at the Sacramento location.
Thank you. There are no members of the public at the Glendora location. Okay, with regard to closed session, meeting in closed session pursuant to Government Code Section 11126C3 to discuss disciplinary matters, including proposed decisions, stipulated decisions, defaults, petitions for reductions in penalty, petitions for reconsideration, and remands. There are no disciplinary matters to discuss in closed session today, and the board meeting will now be adjourned at 11:47 a.m. Thank you.
Nicely done.
Thank you, everyone.
Thank you.
Thank you. Thank you.
Bye.